on the News Channel 5 network. This is OpenLine.
Good evening, everyone. I'm Carrie Sharp. Thank you for joining us for OpenLine tonight. We have such an important topic to discuss, the topic of teen vaping, and really vaping for anybody and the dangers of it. It is your chance to call in and talk to an expert in this, and my expert tonight is Dr. Jacob Kaslow from Vanderbilt Children's Hospital. Dr. Kaslow, thank you for being here.
Thank you very much for having me.
Such an important topic overall, but especially today as we got news that a 26-year-old Nashville man has died from a vaping-related illness. There's been 53 cases of illnesses across the state, hundreds across the nation. Nearly every state has been touched. What have you seen personally at Vanderbilt Children's?
So at Vanderbilt Children's, we've seen patients, most of them ages 15 to 18, again, only because the adult patients would go to the adult side. And we've seen them coming in with a host of different symptoms, often coming in cough, fever, shortness of breath. Some have come in with severe respiratory failure, needing mechanical ventilation and life support. Luckily, we've had no deaths at the Children's Hospital, but I'm afraid that it is just a matter of time, unfortunately. And we are seeing some evidence of maybe that's not happening as frequently, which is a good sign, but certainly not slowing down at the rate we would hope.
You said you've seen confirm 1 or 2 cases of vaping-related illness, but you suspect there have been far more.
Absolutely. So when we talk about confirmed cases, they have to meet a very specific set of guidelines. Okay. You have to have used electronic cigarettes in the last 90 days. Most of the patients that come in with vaping-related illnesses meet that criteria. They have to have opacities or infiltrates on imaging of their chest, so whether that be a chest x-ray or a chest CT. But the difficult part is they have to have no other infectious workup or any other reason or plausible explanation for their respiratory failure. Oftentimes, these are young adults, so they're out there in the community, and so they come in with maybe a little bit of a virus, which wouldn't explain the severity of why they came in, but it means it makes it difficult to pin it just directly on the vaping. And so we've had many cases like that, but of the ones we can confirm with the CDC type definition, yeah, only 1 or 2. And
I wonder also just how many kids are fessing up to, yeah, I vape.
Absolutely. So initially, before all of this came out, we had a fair amount of kids, young adults, teens who would say, yeah, I vape, and their parents would be in the room, or their parents would say, yes, they vape, because the dangers weren't quite there. I guess we didn't know. The dangers were certainly there, but we didn't know. Yeah. And so they thought, it's just water vapor, there's some flavoring, it's not harmful, it's keeping them out from smoking cigarettes or smoking, something else or doing any other drugs. And so they would admit to it. It was kind of not a big problem to ask. Now, as these injuries have come out and the stigma is attached to it, and certainly it's all over the media, what we're really seeing is, I think, less people are admitting to it when the parents are in the room. So we really have to kick them out, ask, and then we get a little bit more of a truthful answer. I
was reading today about this a lot, and something that just shocked me was an article, I think it was in the New York Times, that said when you take an x-ray and look at the lungs of someone with a vaping-related illness, it looks like they have chemical burns. Like an industrial accident.
Absolutely. So the x-rays we're seeing, it's not just, when you have a pneumonia, it tends to be in one spot, or maybe it's a little bit on both sides. When we see, and this is across the national data, what we're seeing is when we get x-rays, it's all over. Because if you imagine you're inhaling, it's not going to one side, it's not sitting right here, it's spreading to all parts of your airway. So if you think of your lungs as sort of an upside down tree, and you've got your trunk and the branches, and it branch all the way to the little air sacs. Well, when you inhale, it's going to all of those. And when you say it's a chemical injury, that's exactly what's going on. People who've done lung biopsies or who have looked at the cells under a microscope say this looks like a chemical injury. Flavorings, chemicals that are found in what we call popcorn lung. So people who work in factories where they produce microwavable popcorn and they have the flavorings, those chemicals that are kind of aerosolized when they're working in the factory, there are warnings in those factories that these workers may, if inhaled, these chemicals can cause severe health effects. When they looked at 50 or I believe it was 50 or 60 chemicals, they found 91% of them had the same chemicals in them as they did in the microwavable factory, or in the microwavable popcorn factory. So these are chemicals that we're not allowing workers to inhale. We're setting national standards, OSHA, and yet here they are in the e-liquids,
being advertised,
and they're being aerosolized and being inhaled.
Yeah.
And so it's scary what we're learning, and every day we learn more and more, and it just becomes a little bit scarier.
Do you think children are more vulnerable to the side effects of vaping?
I think so. I think the lung is developing. We know the lung develops through adolescence. And so if you're inhaling chemicals not meant to be inhaled, you're certainly doing something to that development. We can't say exactly what it is, only because it's so difficult to do this type of research. I mean, these products have only been on the market in the US for maybe 10 years. I mean, it took us 20, 30, 40 years to really understand what cigarettes and cancer, the connection, but we're just now starting to deal with this. Compound that with anyone can make their electronic cigarette liquid. You can buy them from multiple different distributors, you can make your own, you can mix them. So studying just one brand doesn't really give you a lot of information, because a different brand could have a totally different composition.
What has been shocking to me as we've seen this all evolve is just, as you mentioned, it took decades to learn the harmful side effects of cigarettes, just really what they do. It has been mere years from the time that these e-cigarettes were introduced to where we are seeing people die, and to be able to say they're dying because of this.
Absolutely.
That's shocking.
And it takes years to develop cancer from cigarettes. Not to say that a short course of cigarettes is safe by any means, but it's usually the people who are using them for long periods of time. What we're seeing, at least in the adolescents, and what the literature is showing us, is you don't need to be vaping for a long period of time. It's short time exposures that can cause this lung injury.
Yeah. I want to remind you, this is OpenLine. If you have a question for the doctor about vaping, about what he is seeing, about what it does to the lungs, right now is the time to call. 615-737-PLUS is the number to call. We'll get those calls lined up and take them throughout the next hour. So please give us a call. Even if you need to know how to talk to your teen about this and how to warn, maybe scare him straight. This is the time to get that information, because this guy has seen it. I do want to talk about the symptoms that you're seeing, and then the treatment. How do you get these kids better, and are there long-term side effects that you expect these kids to suffer from?
So when we talk about the symptoms, what we see at the Children's Hospital, I think, are just the tip of the iceberg. I mean, we're seeing the sickest of the sickest. I mean, these are the ones who are being admitted not just to our floor, but to our intensive care unit. Some of which are needing mechanical ventilation, which, a tube down your throat and a ventilator to breathe for you, because the lungs are so injured and so damaged. The vast majority of those kids have come in, they've had a cough, they maybe had a little bit of a fever, they may have gone to their pediatrician, but I don't think we were asking the right questions initially. And so I think the vaping history was being missed. And I think this has been going on for years probably, and we just now are starting to understand, well, we need to ask. Because if we don't ask, then we don't know, and we can't make that connection. We saw our first case in July of last year. And so since then, we've been kind of thinking about it, looking for it, and asking. And we've been picking them up slowly along the way. But certainly now that it's got the national exposure, I think more pediatricians, more community providers, more emergency department providers, the people on the front lines are asking, and that's why we're seeing such a big uptick. Now, they come in with these symptoms that seem vague, right? I had mentioned cough, I mentioned shortness of breath, maybe some fever, some headache. A lot of them have some nausea and vomiting. And the really scary thing going into the winter months is that this looks like flu. So if you put a patient with vaping-associated lung injury or any of these related type terms, we're not quite sure what we're calling it. I know the CDC just changed the name a couple days ago. And you put it next to flu, it's going to be very different. They're going to be very difficult to tell which is which, or what's causing the illness. And the scary thing is it's two very different treatments. Now I guess we can talk about the treatment. The unfortunate part is we just don't know yet.
So it's kind of experimenting.
To some degree. I mean, we know that if you have lung injury, we know that chemical injuries and things that cause inflammation throughout your lungs, oftentimes things like steroids will help reduce that inflammation. What we do know is the avoidance of that insult. So in this case, the avoidance of the vaping or using the electronic cigarette, the avoidance of means that the body can start to heal itself. Really what we've done is we've done that where we watch the monitor. Some need antibiotics because they get pneumonias, what we call superimposed. So when you have lung injury, you're more susceptible to infection, more susceptible to viruses, pneumonias, infections that we just don't expect to be as severe, but they come in real severe. And so when we treat with steroids, it's usually for the sickest of the sick. And that's because we need to help their body heal. But really what we do know right now is that it really boils down to avoidance. If we can stop the lung insult, and by that I mean the vapors, the chemicals, everything in it, then the body should be able to heal itself.
Will they be able to get their lung capacity, their lung health back to where it was before vaping?
So we sure hope so. Of the kids we've seen that have come back and followed up, we are showing that there is some lung damage, at least in the short term. There's some data coming out of some other states who have a couple, 1, 2, 3 kids that they're also following, and they're also showing similar things where when you do lung function testing, you have what's called an obstructive pattern. And there's 2 types. So there's obstructive and restrictive. And restrictive means I just can't breathe in. I can't get my lungs to expand enough to get the air in. Obstructive is you just can't get it out. When you blow out, there's just something obstructing. It's in the way. And that's what we see. We see that a lot in kids with asthma, with congenital anomalies and things like that. But we weren't really seeing it before, and now we start seeing it developing in some of these young adults. We hope it's reversible. Yeah. But again, this has been such a short time period. We don't have that data. We don't have that 5-year, that 10-year data.
Very interesting. Okay, we're going to take a quick break, Leanna. I know you're on the line. When we come back, we'll get right to your call and talk more about this. Stay with us.